Thank you. Good afternoon, everyone. My name is Astrianda, and I'd like to thank Dr. Shalini for inviting me, as well as all the organizers. It's my honor to be here. So I would like to talk about the glaucoma drainage device in Indonesia, and we did a little study in our center. So as we all know, that glaucoma is one of optic neuropathy that has a clinical feature of excavated optic disc with loss of peripheral vision and loss of retinal ganglion cell, and it is a progressive disease. So GDD is one of the most important surgical options, especially for refractory glaucoma that is unresolved by medication and filtering surgeries. All of my previous speakers have already talked about this, and the aim of GDD is to create a specific channel that can drain aqueous humor from the anterior chamber to the designated reservoir area. And the techniques and types of GDD placement is still evolving at this moment. So in Indonesia, at the moment, we only have access to Ahmed glaucoma valve. And we recently, well, maybe less than 10 years' time, we have this non-valved implant called the Virna glaucoma implant. The inventor is my dear colleague, Dr. Virna. And the Virna glaucoma implant is, by size, it's not too big. It's similar to the Ahmed valve. It's a 14 mm by 11 mm device. And it is made from the PMMA, the body of the device, and with a silicone tube glued to the body of the implant. In the early invention of the tube, we can see that it's quite efficacious. The mean pre-IOP in the early days of early studies were 39 millimeter mercury, and during the 18 follow-up time, we can see that there's a significant drop of to 15 millimeter mercury, and also a drop of medication pre and post-operatively at 18 months. And the age for this patient group that we did a study on was 46 years old, and most patients were secondary glaucoma. Most of them are rubegotic or silicon-filled eyes. So the GDD that we use in Indonesia mostly indicated for primary glaucomas with failed trabeculectomy and other secondary glaucomas, including the neovasculars, the eyes with penetrating keratoplasty and retinal detachment surgeries, as well as traumatic glaucoma, uveitic glaucoma, and other syndromic eye diseases. We try not to put GDD in eyes with severe scleral thinning, as well as expansive fibrosis in the conjunctiva. And in some cases, we put extra care in patients with vitreous in the AC and silicon-filled eye for GDD implantation. So let me talk about VGI a little bit. So this is the early studies that we did for in the beginning of 2016, I think. So the bleb, as seen here, might look a little bit stretched out, the bleb wall. So mind you, this is a non-valved glaucoma drainage device. And the beginning of time that this GDD is introduced, we didn't do a tight ligation of the tubing. So it might look like this in the first post-operative period due to high fluid flow. And this is 60 and 90 days post-operatively. And this, in the beginning, we saw that there's a lot of hypertensive phases in the following months. So we start doing a no-flow ligating tube with Vicryl, and what we saw is the high IOP, but with less hypertensive phases later. So recently, we are still ongoing, we're doing an ongoing study, but recently we see a lot of exposed tube in some of the, in our cases, GDD cases in Indonesia. And of course, we know that this is a bad sign. It can lead to GDD failure and infection and, of course, permanent blindness. So we're not able to identify which risk factors or any factor that might contribute in the incidence in our population. So we did a study between the year 2020 to 2022 to see how's the proportion of exposed tube occurrences, and risk factors include age, gender, onset of the tube exposed, and diagnosis or type of glaucoma. Also, how about any previous surgical history and characteristics of GDD or tube fixation techniques. So this is a descriptive retrospective cross-sectional study done in our center in Jakarta. And we recruit patients with exposed tube during the period of January 2020 to December 2022. Sorry, it's a typo. And we exclude some medical records that are untraceable. We found a total of 693 GDD implant in this time, and found about 21 cases of exposed tube, which is 3%. And most of the cases happen in older adults of 14 years and older, with a mean age of 47. And there's no difference, that many difference between male and female groups. Most of the cases that has tube exposure are related to silicone oil filled eye. And the duration of exposed tube from the initial surgery have a wide range of up to 4 to 148 weeks, with a mean of 33 weeks post-operatively. These are the history of surgery that the patients who has exposure had. Most of them had phaco-IOL, although we didn't manage to detailedly find whether is it a combined surgery or a sequential surgery, but some also have history of vitrectomy. Most implant that we use these days are the Verna glaucoma implants, so therefore more patients that have tube exposure is in the patients with the VGIs. The fixation techniques varied from scleral flap, pericardial flap, pericardial graft, and scleral graft, but unfortunately, many of the studies were not documented well which fixation technique was done. But from the data that we are able to gather, some of the pericardial grafts has more chance of tube exposure. So I'd like to discuss maybe about the why this is happening. Of course, we know that conjunctiva health may have a huge part in this incidence, of course, and this is multifactorial, might be a cause of aging or degenerative, and also it may have a relation with pathogenesis, pathophysiology of the conjunctiva itself, depending on what diagnosis or what disease that a patient has in the past, the past surgery and implant type, as well as the fixation technique. So in our study, it's maybe the incidence is not very different from previous meta-analysis done. So it's still between 0 to 12%, and there's no difference between gender, and the duration might be a little earlier than some of the available studies. So the patients in our case happened in the mean of 33 weeks or about 8 months' time. And the ones that have exposed are mostly older than 40 years old. This is, in some studies, it says that some younger patients have more risk of tube exposure, but it's slightly different in our side. And has a past surgery of vitrectomy, which is understandable. Probably this have an effect on the conjunctival health. In implant type, well, this might be biased because we do a lot of VGIs. So in these cases, we report more VGIs than Ahmed. And the fixation technique, although again not well documented, but pericardial graft is one of the more tendencies that has a tube exposure. So maybe in summary, I'd like to say that GDD is still one of the preferable options for refractory cases. And in Indonesia, Verna glaucoma implant is gaining more and more popularity because of its availability, and it's more affordable. Tube exposure is a complication that should be avoided, and understanding its risk factor is advisable and can help us to do a patient selection. Tube fixation is a key, maybe the only one, or maybe one of the modifiable risk factor that we need to decide before the surgery, because it can predict the complication. And in our case, maybe pericardial graft is slightly higher than the scleral flap, so this might need a further study, but it's something to be think about. So that's it. I'd like to thank my colleagues who helped me put together everything, and I thank you.
Thank you so much, Dr. Suryono, from all the way from Jakarta, and presenting such a good study with big numbers, 693 cases that